To briefly introduce myself, my name is Ibtali Said, a clinical pharmacist and a clinical pharmacy preceptor from Egypt. And it was an honor to meet you before in a FIP World Congress in Denmark, if you can remember. So, yeah, today we are delighted to speak with Master Sherif Guorgio, FFIP, an internationally recognized pharmacy leader with over 3 decades of experience across community pharmacy leadership, advocacy, and professional development. Mr. Sherif has held numerous leadership roles with international and national pharmacy organizations, including the International Pharmaceutical Federation (FIP), and has been a strong advocate for advancing pharmacy practice and expanding the role of pharmacists globally. On behalf of FIP ECPG Publications team, thank you once again for accepting our invitation. And before we begin, may I kindly ask you to briefly introduce yourself to our audience?
Well, first of all, thank you so much, Tal, and to you and to the ECPG for having me today. I'm Sherif Guorgio. I'm a third-generation pharmacist from Canada, and I'm currently the co-CEO of On Farm United, which is a network of independent pharmacy owners in Ontario. We have about 600 pharmacies in our network, and I also do a lot of volunteer work. Whether it's on community, political, or professional levels. So in addition to my day-to-day job, I also serve on many boards, including, of course, being the president of the FIP Community Pharmacy section. So I always enjoy connecting with colleagues, especially students, new grads, and early career pharmacists. You are the future of the profession. And I really enjoy talking to you. So I'm very much looking forward to our conversation today.
Thank you very much. It's truly inspiring to hear about your journey and experience. To begin our discussion, I would like to start by exploring your professional journey and what initially inspired your path to the pharmacy field. You have over 3 decades of experience across community pharmacy, leadership, and advocacy. Could you walk us through your professional journey and what initially inspired you to the pharmacy field?
Well, in terms of what inspired me to pursue pharmacy, so I mentioned earlier that I was a third-generation pharmacist. The reality is not only I'm a third-generation pharmacist, but almost everyone in my family and extended family is either a pharmacist or a doctor. So it's very interesting because I almost feel like it's literally in my blood. So I was almost destined to go down that path and become a pharmacist, which I very much enjoy. In terms of my professional journey, it's a very long journey. And I think what I'll probably do is I can give you a very high-level overview of the milestones that shaped my journey. And certainly if there is any one particular area that you would like to get more information on or for me to expand on, I would be more than happy to do that. So I started my career as a relief pharmacist or a locum pharmacist. And I was basically doing shifts in different pharmacies. And I was always going back to the pharmacy where I did the relief shift at and talking with the pharmacy team there and telling them, did you call that patient? Did you follow up with this? I left you a note here. And people would be telling me about, why are you here? I was there on my own time, but people would be telling me, like, why are you here? Like, you don't work here. You know, you're just a relief. You fill the shift and that's it. And so I did this for a very short period of time, literally a couple of shifts or so. And then I realized that doing relief work is not for me personally. I cannot get detached from the patient. I was not just filling a prescription, but I wanted to make sure that follow up and follow through on the patient themselves. So I said, it's not for me. Again, it doesn't mean it's not for everyone. Obviously, it's an important job and it's needed. And I'm glad that other people are okay with that. But for me personally, I felt that there was something missing. So I tried it didn't work for me. And so I started to work in independent pharmacy. And I also worked in retail chain pharmacy. And I also worked in a grocery store chain pharmacy, where pharmacy was a department within that grocery store setting. So I worked in different settings, basically. And then from there, I went and I opened my own pharmacy. And from there, I went and I joined one of the main retail chains here as a franchise associate owner with them. And it was interesting because when I joined, I was always letting them know about all the changes that I was making within the store. And almost on a weekly basis was sending them updates on all the different things and changes I made. And then when an opportunity came to join them in the corporate office, that was my next milestone. And from there, I joined another retail chain in the also in the corporate setting. And it was really because that other corporate role was more challenging. So all of the different milestones in my career were almost not just milestones, but also stepping stones. Like each role that I was moving into was building on the experience from the current role, the previous role, and also adding another layer of complexity, of challenges, which you need to welcome in order for you to grow. So I was always looking for more challenges. And then from there, I went to worked in the advocacy body as a vice president of pharmacy there. And from there, I went to take on another challenge, which was creating a new pharmacy group entity in the Ontario market. It was the company at that time was United Pharma Group. They approached me. They had 60 pharmacies in their network. And to me, it was too much of a challenge to walk away from. Again, what drives me is a challenge. And what they presented me was too big of a challenge to pass on. So they wanted to basically create a new entity, a new group within the marketplace. And they had 60 pharmacies. And I worked with them for 2 years. We went from 60 pharmacies in the network to 130 pharmacies. And then from there, coordinated the merger with another company in Ontario. And we are now on Farm United, and we have about 600 pharmacies in the province. So that's on the work side, but also I've been involved in many volunteer work alongside my professional journey. So I served on many different boards and many different committees, whether it's on regulation, advocacy, locally, nationally, and internationally. So again, it's a very long journey, and I try to give you a very high-level synopsis of my career journey. Unless there is any one particular area that if you feel that I would like to expand on, happy to do that. But just generally speaking, that's my journey.
Thank you so much. That is very insightful, especially your perspective on how your early experience shaped your professional direction. And as a third-generation pharmacist and an internationally trained professional, how did your transition and career development shape your experience on global pharmacy practice? That's
a very interesting question, and I tell you what, I found that pharmacists all over the world, it doesn't matter what language we speak, it doesn't matter what culture we come from or what background we have. As pharmacists, we share the same vocation. We share the same passion for our profession, for our patients. We want to do good for our patients. The only difference in terms of how we can do that is on regulatory landscape and the political will. Those are the main differences. And I can tell you that it's interestingly enough that most of us don't realize that we all share those same challenges, opportunities, and goals. So in speaking with different colleagues, different parts of the world, everybody sometimes feels that their situation is very unique to them, that their problems are very unique to them. And what has been very rewarding with FIP and the community pharmacy section of FIP is having the opportunity to meet with colleagues in different parts of the world and showing them that they are not alone, that the problems and the challenges and the opportunities that they are facing, we have been dealing with them in different parts of the world. And we can share tactics, we can share resources, we can share best practices on what works and what doesn't in terms of advocacy. We can sometimes be even more actively involved from an advocacy perspective if needed. So I think it has been a very eye-opening experience to realize that it doesn't matter where we practice. At the end of the day, as pharmacists, we speak the same language, which is the language of patient care.
Thank you for sharing that. Your journey reflects a remarkable combination of leadership, adaptability, and global engagement. Looking back, what key milestones or decisions have most significantly influenced your career right now?
There were a few milestones or decisions that have certainly had a very big impact on my career path. And one of them was at the beginning of my career. And that's when I passed on a very lucrative offer from one company to join them as an intern. And I accepted an offer with another company to do my internship with them. And it was literally for half what I was offered elsewhere. And obviously the other people were not quite understanding how a new grad would make that decision. Obviously, people always want to be looking after what pays more. You have student debts and loan debts and all of these things. But that was a very important decision for me to not go for the higher offer. Similarly, around halfway in my career, I also walked away from a very high-paying job. And even when I was walking away from it, they came to me and they offered me the bonus to stay. So in addition to being a high-paying job, I was also offered a very high bonus to stay. And I still walked away from it. I said, because it's not about the money, it's really more about, again, the career path. And once I have made the decision that this path or this role I was in was not going to lead me to the path that I want to be on, the decision was very easy. So it may sound like a very tough decision, a very hard decision to make. And I share it because I think that most people would not make that decision. I think most people would go for the sure thing or the higher paid salary. That's why I share this, because maybe someone will realize you have other options. But how you know that you have other options? You have to have a plan for your career. And I always use the analogy that you should have a GPS. Like we all have GPS now on our phones. You don't go anywhere without putting a GPS on. It's a similar thing for your career. You have to have a GPS. You have to know basically what your final destination is. And you have to take some time to think about it. And the good thing about our profession is we have so many different options in our career that we can take. But once you decide on where you want to go and what your final destination is, then you turn on the GPS. And what the GPS will do is that sometimes you realize that you may be on the highway, but you're stuck. There is a delay. And you realize at that time that it is okay for you to make an exit, to even make a U-turn sometimes, and then to go back on the highway again, but from a different route. That's what having a GPS for your career is. So for me, when I walked away from these opportunities, it was not just walking away from them, but it was really more about following the GPS. It was about taking an exit, knowing that I'll get back on the right track, or making a U-turn sometimes because I had gone from high-paying job to a lower-paying job because that lower-paying job was the next step that will put me back on track. So you have to look at your career as a path, not as a job. Because if you look at a job, then you always look at how much money I'm making. If you look at your career as a path, you will start to see that you're not going to be asking yourself how much money I'm making in this job or in this role, but how much I am growing in this role. And it's two different perspectives. It also depends on what you want. And if all you want is a job, there's nothing wrong with that. But if that's all you want. But if you want to have a career and if you want to grow in your career, then you cannot be looking at what you're doing as a job. Two different things. And none of them, they're not, like I said, both of them are not wrong. It all depends on what you are looking for and what you want to do.
Thank you so much. I would like now to move towards your leadership and advocacy work, which has clearly had a significant impact on the profession. You have held numerous leadership roles within organizations such as FIP and national pharmacy bodies. What does leadership in pharmacy mean to you today?
Leadership means different things to different people, and I think also within different contexts. In pharmacy and in advocacy, leadership is about inspiring colleagues, inspiring people, inspiring pharmacists and students to feel empowered to do more. And also leadership in pharmacy advocacy is about doing everything that you can full-heartedly to advocate effectively for the colleagues who trusted you to be their voice. From a general perspective, leadership is about lifting people up and not putting them down, and it's also even taken as far as even saying that proper leadership is about shining the light on others, including sometimes your competitors.
This is a very important perspective, particularly in today's evolving healthcare landscape. Advocacy has been a central theme in your work. How can pharmacists strengthen their role as advocate for both patients and for the profession as well?
One of the messages that I've been sharing consistently, I guess, over the past while has been about telling our story. And as pharmacists, we can strengthen our role as advocates by telling our story. We have to understand a couple of things. One, that the public and policymakers, it's not their responsibility to know our story. It's our responsibility to say it to them. And also, the second thing we have to realize is that if we do not tell them our own story, others people will, and they may not get it right. So I think the main thing that we can do and should do is always feel inspired and feel comfortable to be going to our patients, to the public, on social media, to policymakers, and to legislators, and to stakeholders in the industry, and tell them about what we do and the role that we play in ensuring that we are keeping our communities safe and healthy every day. That's how all of us can play a role in advocacy.
Thank you. Expanding pharmacists' contributions to healthcare remains an important discussion globally. You have been actively involved in advancing community pharmacy practice. How do you envision the expansion of pharmacists' scope of practice worldwide?
I think it will continue. I think we will continue to see expansion of scope of practice for pharmacy professionals worldwide. And that's because, to a big extent, thanks to the pandemic, in a way, obviously the pandemic was a very negative thing that happened in history, but it made governments realize that there are gaps in the healthcare system. And it also showed governments globally that pharmacists can play a role in filling those gaps, whether it's through our convenient, timely, frequent access, whether it's through our expertise, and also whether it's through the trust that people have in us. We consistently rank as the most trusted healthcare professionals, or among the most trusted healthcare professionals. That's all over the world. We have the knowledge and expertise to dispense medications, to prescribe, to administer medications, again, depending on the scope that we have in the jurisdiction we practice in. And we also have a very big advantage, which is most of the population lives within a walking distance from a pharmacy. And again, this is globally. A lot of people see their community pharmacists more than they see their doctor. And those were all factors that government started to realize. And when they started to see that we can help with COVID-19 testing, with COVID-19 vaccinations, and so on, and they started to see the impact. We used to go to them in the past and ask them to give us more scope. Now they're starting to come to us and basically say, well, what more can you do? So I think that this is going to pick up certainly worldwide, and we're seeing many jurisdictions where the scope of practice is starting to expand.
Thank you so much. I would now like to discuss mentorship and your advice for the next generation of pharmacists. You have been a mentor and leader to many in the profession. What does mentorship mean to you personally?
Mentorship is certainly very valuable, and I would very much encourage students and new grads to seek mentors when possible. And mentorship is not just only about sharing experiences, but it can also help with expanding networks and also opening doors. But I would not just limit it also to that. In your workplace, you don't have to necessarily have an official mentor, so to speak. You should always seek feedback, and don't seek feedback with the intention of hearing a lot of great things about what you're doing, but actually ask specifically on, can you tell me what can I do better? What can I improve on? So seek feedback for the purpose of growing, not for the purpose of tapping yourself on the shoulder. Two different things. A lot of times we feel that we want to get validation from the people we work with, that we are doing a good job and so on. That's not going to help us grow. At work, if you go to the person you report to and you say, I would like to get some feedback on my work, it doesn't have to be you don't have to wait until the performance review time, but you can even do it throughout the year. And from time to time, you go in and say, can you tell me what I can do better? Not what I'm doing right, what I can do better. And even during the performance review, a lot of times, I tell you, that's what I used to do personally. In my performance reviews, I would tell my boss, can you please skip over the good things that you think I'm doing? I don't want to hear them. If you think I'm doing something good, well, I'm already doing it. I don't want to waste the time in hearing that. I don't need that validation. What I would like to know and what I would like to spend the time on is, can you tell me where you see I can become better, where you see I can do better? So you can also or explore or pursue mentorship through those different avenues without necessarily having to be a structured process as well.
That's truly a valuable advice, especially for early career pharmacists seeking guidance and inspiration. What advice would you give to early career pharmacists who aspire to leadership roles or international engagement?
I would say first to go for it. Follow your passion. Take that step, put your name forward to serve on boards, serve on committees. And if you don't get elected the first time or selected the first time, my advice to you is don't get discouraged. It is okay. Everything happens for a reason, and everything happens at the right time. You have to believe in that. And so you just keep going at it again. And I'll tell you very clear examples. When I first ran for the board of the College of Pharmacists, which is the regulatory body for pharmacy in Ontario, that was like over 20 years ago. The first time I ran, I did not win the election. After that, I became the president of the college. The first time I ran for the community pharmacy section executive committee, I did not win that election. After that, I became the president of the community pharmacy section. So it is okay. It is part of the process. If you put your name forward and you don't get elected, don't get discouraged. Or you still have your whole career in front of you. Keep trying and keep seeing how you can better yourself and how you can work on yourself and don't give up.
Thank you very much, Mr. Sherif, for sharing your valuable insights and experiences with us today. Before we conclude, I would like to ask one final question. Is there any final message you would like to share with early career pharmacists around the world?
Well, first of all, I very much enjoyed my time with you today. And yes, I would like to share with you my secret to success, and that is consistency. Consistency is the secret to succeed in anything, in personal or in work. Now, how to develop the discipline to be consistent on a daily basis, that's a completely different webinar. But the secret formula to succeed is being consistent. I've learned that from a lot of life experiences, and I'm happy to share that with you. And also, again, happy in the future if you would like to delve more into what that actually means. But I'll just leave it at that for now. And again, I want to thank you so much for having me today. And this is a great initiative by the ACPG, and you're a very good interviewer too. So great job. Thank you.
Thank you once again.